Supported self-care is a model whereby there are certain things that can help people to self-care more effectively. And a number of those things are, first of all, having a personalised care plan whereby they set their own goals with the health professional taking a coaching role to help them set goals that are realistic and achievable. Secondly, a structured educational programme and sometimes support from somebody else with the same condition who has learnt more about managing their condition.
One of the ideas behind supported self-care was to give patients confidence in looking after themselves and monitoring their condition. And that has happened here at the Lennard surgery, where a particular patient I remember has been contacting the surgery far less, and we've been able to manage with him his condition at home with far less contact with the surgery.
The good thing about it is it can free up health professionals from the routine monitoring to allow them to spend more time working with complex patients around achieving their goals. And the supported self-care pilot that we're doing with the Lennard surgery is very much about the team working together with the patient to use the technology in the best way to support them.
Telehealth in the past was more about monitoring variables in a patient's condition and getting trends for those variables. Supported self-care is more about trying to help patients understand their condition, understand the differences they can make in their lifestyle and how they look after themselves, and how that can make a difference to their overall care and their long-term outcomes.
We're using different types of technology for different types of patients. Everything from quite a high intensity monitoring, which Gordon here has, to quite a low intensity monitoring. But I think in general, it's about the support that's given. It's not about the technology.
I just found it very reassuring. You're at the end of the phone, my doctor's at the end of the phone, and my dear wife looks after me. She always dresses me and things like that, which she's always done in the past few years. But this scheme, I think it gives you confidence. As I say, if there's anything wrong, you can pick it up, my doctor can pick it up, and it keeps me out of hospital. That is one of the main reasons why I volunteered to go on this scheme.
Supported self-care is really moving away from the crisis management to a more preventative partnership approach for patients, and we're hoping that they'll take a much more active role in monitoring their own health condition, but that doesn't preclude them from accessing early intervention if it's needed or appropriate in order to prevent acute episodes.
I think we have to appreciate that this will not suit every patient, and case selection may be quite crucial, and that can sometimes throw up surprises. For example, we have thought perhaps some of the elderly may not be able to engage with this, but we've been very surprised at the positive benefits it has given older patients and who've been able to manage the technology quite easily. There is evidence out there about telehealth, electronic monitoring. Some of it's conflicting, but there is evidence from the US and from a project up in Liverpool to suggest that this will make a difference to patients in the long run in their care. And part of this Champions project we've been doing here has been about looking to see where we can move forward with the monitoring and support patients in making better decisions about their health with a long-term aim of improving care.